Welcome back. You're watching the Daily Report on our segment Power and Politics every Monday. Tonight we talk matters health, because remember, health is wealth. And my guest is still here in studio, Mary Muthoni Muriuki, the PS for Public Health and Professional Standards in the Ministry of Health. Madam PS, thank you for staying with us.
Thank you.
Now, we're still on, when you look at the SHIF as you talk about it, it sounds, good in envisioning, how the government is going to ensure accessibility of health to everybody. So for a Kenyan who, of course, is watching us and wondering, so does that mean that when I walk into a hospital, I shall not be able to pay any fees? What exactly should they expect? Because at the end of the day, it will involve them accessing healthcare services.
Thank you. That's exactly what we are saying.
Okay.
Equitability. Health insurance for everybody in the country. Whether you're a mama mboga or you are employed like myself and yourself. For myself who is employed, my salary, my gross will be attached 2.75 of what I earn to contribute to the social health insurance. The mama mboga down there, if you have your 300, other than the 500 they used to pay, anytime she has cut herself with the knife, cutting skuma wiki, she can walk into any health facility and get treated without necessarily many issues. She can walk into the facility and once treated, you also get drugs. This is what we are covering. Because many a times is when people have suffered. They go to a facility, we do not have human resources. And remember when I was explaining about the laws, we said that part of the money that is collected in those facilities using the Facility Improvement Act will be plowed back to take care of these issues. Human resources for health, equipment in the health facilities, and equally infrastructure in the health facilities. So with this social health card, it will only start at the level 4 hospital, where you need specialized care, possibly. Maybe you have broken your leg, or you need to be operated, you need a neurosurgeon, you need a gyna, the specialized care that is required. But at the lowest level, we will have the publicly funded through the primary care fund, which will take care of level 2 and level 3. When I talk about levels, I want to break it down because it may not mean a thing to a common mwananchi. I'm talking about the hospitals we call dispensaries. Okay? Dispensaries which are next to our houses. So you will be walking in there and you will not be paying. Why? The government is moving away from more curative to preventive and promotive. We want everybody to take care of their minor ailments at the household, at home. If the CHP can treat you, maybe your child has fever, and we are able to give you a tablet and you don't need to go to hospital. If you need to just be told, yes, you have blood sugar, or you do not have blood sugar, can you go and see this specialized doctor or a staff in a health facility? So if we are able to reduce some of the preventable diseases in our household, we will not even have those queues we have in the health facilities. Long queues. You go in the morning and you leave in the evening, just waiting to see one health worker. Issues like cholera. As a country, we are not supposed to be discussing a disease called cholera because it is preventable. Issues, vector-borne diseases, malaria. You just need to sleep under a net and clear your bushes outside your homestead. And drain the water. And drain the water. Stagnant water. Stagnant water. It is as simple as that. Taking care of ourselves. And that's why we are saying, afya yako, jukumu lako. Before we even go to the facilities, then have we cleared what needs to be done at our level? At the same time, infrastructure improvement is important. In the sense that if you go to some of the places, you will find that a mother is giving birth in an open
area,
which is very demeaning, really. So when we talk about infrastructure improvement, we want to give dignity even to mothers. We want to give dignity to a mother who is lactating, that a health facility has space for women who are